how did you get involved with NBC and MetaViber?
When I was diagnosed, I went to, it was immediately, I was diagnosed April the 2nd as metastatic. And then 3 days later, there was a metastatic breast cancer conference held in my area, held in Philadelphia. And it changed my whole attitude. It's nothing like being in a room full of women who are going through, or people, because men get breast cancer as well.
Have you felt that there are some disparities and things you might want to work on, you know, as a Black woman, a strong Black woman, and maybe it sounds like you have opinions you'd like to share.
I definitely do. And that's one of the things that I noticed even in my early stage diagnosis, is that there were not women that looked like me. It's kind of, breast cancer is kind of thought of as a older white woman disease, and it's actually not. There were not young Black women represented in the ads. I didn't see them even in being discussed. And so that's another thing that I wanted to do, because there are definitely inequities, and we've seen the racial disparities. And so it's definitely in the healthcare, because we have Henrietta Lacks happened, and the Tuskegee experiment, and so forth and so on. And so I've dedicated a lot of my time and my work recently to help bring light to these disparities. But we don't want to just continue to talk about it. We want to be about it. And so MetaViber is in works to hold a conference on the disparities, and to actually work with clinicians, because that's kind of where it starts. I think advocacy is such a small circle right now, especially with women of color. And so I know a lot of the people that are on the board of MetaViber, and they every 2 years they go through this election process. And I was approached by a current member and asked would I be interested. And yes, definitely. And so my name was put forward with other people's, and I was selected to be on the board. And so I'm very pleased to be on the board and to help bring light and information, not only to disparities, but about metastatic breast cancer, and definitely the funding that we need to help the research.
So tell us a little bit about MetaViber, and what is it that they fund, and what is the message they're getting out there?
Okay, so it was started in 2009. So it has more than one evolution by a metastatic breast cancer patient. And so their goals have always been to bring light to metastatic breast cancer, spread knowledge, spread hope, because there are also local peer mentoring groups, support groups. We do have that. And then as it evolved, once the founders discovered that certain organizations only give 2 to 6% funding for metastatic breast cancer, they decided that, hey, we need to be a major funder of metastatic breast cancer because we're dying. And so for a small nonprofit, that is pretty significant, and all of that money went to research on metastatic breast cancer specific.
What advice could you give to others that may not be as strong as you, that may need some verbal support, some sharing with other people? What can you share with other people that are going through this, that are living with MBC? And to be honest with you, what are you doing specifically?
I don't talk like that.
They're going through what you're going through.
Exactly. And so that's the key, is to link up with a mental health professional. Definitely do self-care, take care of yourself before you can take care of anyone else. And then also find a support group, or link up with other people who are going through the exact same struggle that you're going through.
Chawnte, could you tell us a little bit about Citizen?
So Citizen is a great organization. They are a medical records warehouse that's been recently started. And what it is they get your permission, with your permission, you sign up, and they request your medical records from all the different medical facilities that you've been to. And what they do is they digitize it so that, especially in the times of COVID, if you need a consult, if you have progression, or you want to get a second opinion, it's very easy. You let them send your electronic medical record to the new facility. And so it makes life much easier for metastatic breast cancer patients and all patients pretty much.
So
Right.
you seem to know, we've spoken, you seem to know an awful lot about this, and you're now on a podcast. You're a host of a podcast about MBC?
Yes, I'm a co-host on a shared sponsored podcast called Our NBC Life. There are 5 co-hosts. And basically what it is the whole entire team has metastatic breast cancer. So from the people behind the scenes to the hosts are all metastatic breast cancer patients. And we kind of wanted to talk about topics that are important to us. We bring on researchers. We bring on other metastatic advocates. We do a trailblazer highlight of small nonprofits in certain areas that are caring and giving certain services to metastatic breast cancer patients. So it is available on every streaming service where you find your podcast. And every Monday, actually, the podcast this Monday was with Jamil, who is the president of Metaviver, and we talked about her plans and me being on the board. And we also talked about More Fight, More Strong. So if you want to catch our NBC Life podcast, please definitely go to your streaming services and listen up every Monday.
I'm just meeting you for a few moments. I am so impressed by you. I'm amazed by you. I can't believe how powerful you are on screen here, talking to me and everybody else that you're going to reach. So thank you so much for your time today and your knowledge. And I got to be honest with you, my prayers are with you and everyone like you.
It's pretty much my philosophy is to do the things that bring me pleasure. And I think knowledge is power. I want people to know that even though I have stage 4 cancer, I am still hopeful that every day the research that is done, it can find a cure for metastatic breast cancer. Because if you cure metastatic breast cancer, if you stop the spread, you basically cure cancer.